All right, hello. I'm here, Dr. Stacia Laser with Dr. Frank Pirozzolo, and we're going to take this moment to talk a little bit about glaucoma. Glaucoma is a fairly common eye disease or condition that we do a lot of treatment here for. And it's what we consider the silent thief of vision because a lot of people don't have any signs or symptoms of glaucoma until it's very end stage. So we wanted to kind of get a little bit of information, some of the frequently asked questions that we receive as we're seeing our patients.
So, hello everyone out there. You all know me, I'm Dr. Frank Pirozzolo. And I certainly do have a lot of glaucoma patients these days. As we grow a little older, it certainly becomes a more predominant eye condition that people develop. And so we're hoping to give you some tips and things to know about glaucoma. If you didn't know them before, maybe you'll learn them now. As you can see, Dr. Blazer and I, we're keeping a socially safe distance while we talk to you. Otherwise, we would be closer together to make a better appearance in the picture here. But so getting to the issue of glaucoma, as I believe Dr. Blazer already said, it is a silent thief of vision. You would never know that you had the condition. It's something that we diagnose by performing tests. And while the major test in the past has always been the pressure within your eye, we know today now that you don't necessarily have to have high pressure to have glaucoma. There are what is called low pressure glaucoma and normal pressure glaucoma. So in glaucoma, we find that there can be deterioration of the optic nerve because it's not getting adequate blood supply, and that the nerve fibers in the optic nerve are not getting adequate oxygenation because of lack of blood supply. Sometimes it's from the pressure within the eye pushing outward, but sometimes it can be from inadequate blood flow coming into the eye from various other diseases. So it is a multi-organ disease or multi-system disease that can affect you.
In general, glaucoma is kind of what we consider a deterioration of the nerve fiber layer in the eye. And first, it starts in the peripheral vision, and that's why patients don't understand they have it until it's very, very end stage. If it goes untreated, it can lead to blindness. So it is a very serious condition that we want to manage and treat. We certainly can, as doctors of optometry, manage and treat glaucoma, and we do very regularly.
Which is why it's so important to stay on your medication even if you feel nothing is wrong. And you can't judge it by, well, I think the vision through my glasses is good or it's not good, because rarely is glaucoma related to how well you see with your glasses.
Correct.
It is something that has to be tested in an office by a doctor to determine the actual health of your nerve fiber layer.
And not only are we looking inside the eye at the optic nerve and the nerve fiber layer, but we have a lot of technology here in our office to go a step further and look at the technology and the specific cells and things like that. So again, very important that you see us regularly for those checkups and that care to monitor things to make sure you're not losing vision. Again, it can be treated most of the time with a drop or 2 drops or 3 drops. In severe situations, we may get to the point where we have to refer for surgery, and we certainly have surgery consults that we do regularly, but most of the time we can manage it here in the office with the appropriate treatment and drops.
We do have CT technology or CAT scanning technology in our office, which helps us to measure change over time. The most important thing in glaucoma is to monitor any change in the nerve fiber layer over time, as well as monitoring your pressure. Which brings up a point, why do we treat pressure? Well, reducing the pressure of the eye is the only treatment that we know of that can reduce any damage to the, reduce ongoing damage to the optic nerve fiber layer on the retina, short of surgery, of course. If medication's not doing a proper job, there is laser treatment and there is even more advanced surgical treatment. We do have an excellent working relationship with several glaucoma surgeons, and we do co-manage our cases with surgery sometimes as well.
Yeah, so those are a lot of the frequently asked questions we have about glaucoma, and what we do is actually optometry to help manage the glaucoma. Things to keep in mind is if there's a family history of glaucoma, you are more at risk, so we certainly want to know that, as well as the older you get, the more at risk you are for developing glaucoma.
Diabetics are more at risk, smokers are more at risk.
Certain ethnicities are more at risk. So all of these things are factors that we'll look at during your regular eye exam and evaluate if there's any risk factors or concerns we have for glaucoma in your scenario. Okay.
So we just want to remind you, we are here on a limited basis during this crisis. We'd be happy to answer your questions, or if you need a refill on your medications, we can speak with you, we can go over your record, we can order whatever it is you might need, and in the event something very urgent comes up, we can make an exception to come into the office. We do urge all of you to be safe, stay at home as much as you can, and
Stay well. We'll see you soon.
bye-bye.